Good morning, everyone. My name is Blair Grogan. I'm the Executive Director of the Simon Communities of Ireland, and I have the job of just facilitating our Simon Talks this morning, our last Simon Talks of 2025, closing out with a requested webinar as well. Sometimes, Eddie, I'm trying to think of ideas of things that I think people want to hear about. But your name and this, I think, is particular interest, and the time is the timing is really, really great on it as well. So Eddie is going to be giving us a PowerPoint presentation, and then he'll come out of that and we'll go through any of the questions that have come in. So please do feel free to engage with the Q&A box. We're going to be hearing about 1 year on from Merchants Quay's medically supervised injection facility. I'm sure for many of you, Eddie needs no introduction, but Eddie is the CEO of Merchants Quay Ireland, and we're going to learn a bit more about the MSIF, as it was called. We love an acronym now in our sector as well, don't we? For those of you who are maybe new to Simon Talks as well, if you check out www.simon.ie, you'll be able to see some more of the work that we do, and have a lovely branded background here, in case people don't know that we're yellow. I think that's probably enough waffling now for me there, Eddie. I'm happy to, I think people will probably join as we go along, but I know we're all keen to hear from you. So I'm going to mute myself, I'm going to turn my camera off, and I'm going to hand it over to you. And then when you're finished, if you stop screen sharing, and I'll pop back on, and we'll have the chat.
Great, thanks very much, Bear, and good morning, everybody. Delighted to be here this morning. I suppose after the euphoria of the Ireland team yesterday, and of course the tragedy of the horrific road traffic accident in Louth on Saturday night, it's one of those days where you're full of mixed emotions. But delighted to be here today. As Bear said, we're almost a year into the operation of the medically supervised injection facility here at Merchants Quay. We operate that facility on behalf of the HSE. We are, grateful for the support and the entire funding. So the HSE funds the entire operation, and we're delighted for the support from the Department of Health and the HSE, and of course the Minister, in this very unique facility. I suppose I'm very bad at PowerPoint, but I'll try and stick to the slides, and at least there'll be some relevance to what I'm saying. So I'll move to our next slide. And I suppose Merchants Quay, a little bit about the organisation. It was established in 1991 as a homeless and addiction day service. It's started up on the quays here at Riverbank. Very difficult time in Ireland, particularly in the South Inner City, and Sean Casson and Tony Gagan were the two founders of the organisation, and both pioneers in supporting people in difficult circumstances. And the organisation has grown over the years, and we were the first organisation to open a needle exchange. We operate residential detox, rehabilitation and aftercare services in Dublin and Carlow. We provide prison-based addiction counselling services across all of our prisons, bar one. And we also operate community drug and alcohol services and family support across the regions. So it's a very big organisation, wonderful team, and I'm really delighted to be here to represent the organisation today and to give you an insight into the work we do. Many people will be familiar with the history of the supervised injection facility, brought to government in 2015 by Aon O'Riordan, who was the Minister with responsibility for drug treatment service and drug strategy at the time. And there was various pieces of legislation enacted to facilitate the development of the supervised injection facility. MQI was the organisation who won the tender to deliver the service. And of course, that was, everybody thought at that point, that was the hard piece of work done, but it wasn't really. It was when we went to planning to develop the site at Riverbank where we really got stuck into lots of legal wrangles, and took many, many years for their planning to be granted and for the organisation to get the opportunity to develop the service. And as I say, final grant of planning permission was in December 2022. And then we went to tender with a builder in May 2024. And I was very, very pleased and delighted that our builder was able to develop the site within 6 to 9 months, and we opened in late December 2024. And as I say, we operate the facility in partnership with the Department of Health and the HSE, and we're very grateful for their support. So I suppose it's very important to highlight while MQI is the face of the MSIF, we operate, in collaboration with many organisations. And ISCA, for example, peer-led advocacy organisation, and MQI run a partnership to support clients, but also to develop strategies around how we can address issues on the street and how we can work with clients and local community organisations for the benefit of everybody. We have a strong relationship with the Gardaí and community representatives. We have a community outreach team who operate out in the community to listen to the concerns and address issues as they arise. And obviously, our association with ISCA allows us to include the peer voice in the evaluation and feedback of the operation. We also have a stakeholder forum where many organisations and many community groups are represented, and that meets monthly to discuss the operation of the SIF and how it has affected the community. And it's very important to say that, we couldn't operate, we couldn't exist without good relationships within the community. And one of my personal objectives throughout this process has been to build relationships and to include community-based organisations as much as possible as we go forward. So just an overview of the MSIF. It opened in December 2024. And I suppose technically you would call it a safe and controlled environment for individuals to inject drugs. Its objective is to reduce health risks associated with drug use, such as overdose, transmission of infectious diseases. But moreover, it also provides medical supervision and immediate care in cases of emergencies. And some of the, I'll call them the unintended consequences, but the powers that be would tell me they were always the intended consequences. But the opportunity to engage with clients on a range of other health issues has now, really become a prominent feature of the MSIF. So when a client comes in, primarily to come in to inject the drugs, it's an opportunity then to engage with them around other health issues and make referrals as appropriate. So the core services within the MSIF are injecting booths where clients inject pre-obtained drugs under medical supervision. And I mean, we kind of laugh tongue in cheek at this. It's probably the only facility, it is the only facility in the country where you have to have drugs to come into the facility. So when a person comes in, they have to show the drugs. And once we're satisfied they have drugs, they can go in and use the injection booth. And of course, the primary objective here is to prevent people dealing drugs within the facility. Another core service is to provide an immediate response to overdoses. And I will go through some of the statistics later in the presentation around what we've experienced in the last 10.5 months or 10 months. And then, of course, aftercare and monitoring. And aftercare, and you'll see again in the presentation as I go through it, you'll get a sense of what the facility looks like. And the aftercare area within the facility is a very welcoming environment where people who have injected their drugs can come in and we ask them to spend a minimum of 15 minutes. We provide them with some food. We provide them with tea, coffee. And also we have project workers and case workers who can sit there and talk to clients and assess their situation and maybe guide them on a path if they're interested in going on a particular path. And of course, then core services are emergency, GP and nursing for wound care and infection control, which is obviously, we know, a significant outcome for prolonged injection of drugs. And then the support services, we have harm reduction education, including safe injection practices. We operate a number of services out of Riverbank, including primary health care, mental health assessment and mental health team, needle exchange and harm reduction. So all of those referrals can be made from the MSIF, which is in the basement of the building, to any other service within the building. Also provision of sterile injecting equipment and health checks and advice, including testing for bloodborne viruses. So You'll see, I think what makes the service quite unique is the fact that it is integrated with a number of other support services, which are vital for people who are very vulnerable and very marginalised. So we're very pleased with progress so far, and we'll go through some of that as I move on in the presentation. So how does the facility operate? Well, there are a number of safety protocols, strict safety protocols to manage overdoses, prevent the spread of infectious diseases, and ensure a safe environment for staff and clients. And as many of you will know, when we work with people who are drug dependent, there is an element of, I'm going to use the word because I can't think of another word, chaos associated with people who are, in difficult circumstances. So our staff are very well trained and operate under strict guidelines and protocols to ensure that respect, but boundaries and also dignity are also observed. Obviously, we have a quality assurance program, regular staff training, ongoing service evaluation, and adherence to best practice. And prior to the opening of the facility, we engaged extensively over the 12 months in advance of opening with a number of other organisations who operate facilities across many jurisdictions. So we gained a lot of valuable experience and understanding as to how to operate a facility effectively. And I think those learnings have stood to us so far in how the facility is developed and how it has supported, as I say, some people who are very, very marginalised. And obviously, throughout this process, as it is a pilot, I should have explained that in the very beginning, and we'll maybe talk about that a little bit further. Data collection and monitoring is essential. Ongoing monitoring of the impacts, including data on overdose interventions, referrals to services, and our client engagement, and of course, the impact on the wider community. And that's where our stakeholder forum plays a huge role in engaging the impact this facility is having on the local community. And in tandem with all of this, there is an independent assessment and evaluation process operated independent of Merchants Quay and the HSE and the Department of Health. And they've issued their first interim report, which was a 6-month report, and they will issue a final report after the 18 months of the pilot, and that will present the facts, the data, the impact, and hopefully signpost where we go in the future. It is a pilot, and because it's a pilot, there is always that risk that policymakers and powers that be might look at different strategy and change approach. And I'd just be very conscious that they don't reverse the bus on this. I think we have demonstrated so far that this is a vital service for some of the most marginalised people. And what it does is it complements other services for people. So drug treatment services, like any other health services, they're complex and they are varied. And this is not the panacea for drug treatment, but it is a very important service for people who use drugs who need that support. So this is just to give you an idea of what the facility looks like. And as you can see, it's a very, very warm, inviting, trauma-informed, developed facility. So the first point of contact for clients will be our reception area, where they will meet a project worker or a nurse, or both perhaps. And the client will give some basic details around their identification. The project worker will use that opportunity to assess the person, see if they are drug affected when they arrive in. If they're not, look at the type of drugs they're going to use and explain how the facility works. And it's a very brief interaction. And at this point in the pilot, many of our clients know the facility quite well. So that interaction is very brief, and they come in, they just present the drugs, and they move on to the injection booth. There are 7 booths available in the injecting room, and as you can see, it's a very bright clinical environment, and it's designed like that for a particular purpose, because there's a very, I suppose, it's an intricate and dangerous and potentially dangerous practice. So we need to provide all of the right services in the right environment for people who are injecting. So we will provide sterile equipment. Clients themselves usually know the type of equipment they want. The nursing and project staff will be there present to ensure safety and support. We have, for example, a vein scanner, which for many of you will know, for people who've injected drugs over a prolonged period of time, one of the big challenges is to find a vein. And this vein scanner has been a game changer in terms of helping a client find a vein in a timely manner. And I suppose many of you will know, people who know the culture around people injecting drugs. there's an apprehension, there's an anxiety when it comes to injecting drugs. So to make that practice safer, will avoid potential, would say, needless injuries and potential abscess and other health complications that are associated with injecting drugs. So that vein finder is a very important piece of equipment and very valuable in terms of helping the client find a vein in a timely manner. And of course, one of our primary objectives is to intervene in an overdose situation. And our staff are very experienced, our nursing staff, our project staff are very experienced and know when it's appropriate to intervene. And we have built up a very strong and, I suppose, trusting relationship with our clients around overdose intervention and when it is appropriate to intervene. And I'll give you some statistics on our overdoses as we move through the presentation. So our GP nursing rooms, again, we have a GP on site for between 10 and 15 hours a week. And that's GP together with the nursing staff will manage overdose situations, deal with emergency health situations, and general nursing and doctor assessments and wound evaluation and care. And the feedback we get from a lot of the people who use our service is that, and this is not a poor reflection on our health services or a criticism of our health services, but people who are drug dependent have a reluctance to attend emergency departments unless it's absolutely necessary. They feel somewhat ostracized from the health system. So having a facility within the MSIF where general medical assessments can take place and wound evaluation and care can happen, and that dignity and respect that, sometimes is lacking for people who are in addiction can be provided in a facility that is specifically designed to support people who inject drugs. So we're very proud of the work that we can do in this facility, other than providing a facility for people to inject drugs. And again, then we move on to our aftercare facility. And again, this is probably, I would say, one of the most important aspects of the supervised injection facility is aftercare. And both from a health and safety and overdose prevention perspective, but also from what potentially can come afterwards. So when a client is finished in the injection booth, they will come into the aftercare unit. As I say, chairs, as you can see on the screen there, they're very comfortable. Sometimes they're too comfortable, and we think we shouldn't have recliners because people are reluctant to leave. But we haven't had a problem. We haven't had to eject anybody from the site at this point. But the idea is that a person will come in and they will engage with our project workers and discuss what they want to discuss. So we don't lead the conversation; the client leads the conversation, and we're happy to go in whatever direction the client wants to take the direction in. We would always be hopeful. Like many people on the webinar today, I'm sure most people on the webinar today are very familiar with the catastrophic nature of prolonged drug use. And we would never advocate for people to use drugs, but we advocate for people who use drugs. And I think there's a very important distinction there. So our project workers are trained, like many people on the webinar today, to provide trauma-informed support to people and maybe guide them in a direction or point them in a direction if they look to go in that particular direction. So we're not naive. We don't see this facility as a roadmap or a route into recovery, but it is a potential route into recovery for people who may want to take that path. We also provide access and information and advice about other health services and social services, and we have a strong working relationship with many organisations like the Simon Communities and the HSE and the DRHE and other organisations, and we work very closely to support people and direct them to other services as appropriate. Again, as I said, tea and coffee and snacks are available. Very important. People like to feel welcome, like to feel respected, and when you provide a cup of tea, some of the best conversations can take place over that cup of tea. And then obviously client-led, based on a person-centered approach. So we're listening to our clients every day. We're listening to their feedback. We're trying to improve the service. We're trying to take into account the needs and desires of the clients in a very respectful way as much as possible. So service numbers, we've had 1,306 unique clients use the service. We've had over 12,899 visits. 73% of people who visited the facility reported heroin as the drug they're using, 8% crack cocaine, and then another smaller amounts of different other drugs. We don't have a testing facility on site, but we work obviously like other organisations closely with the HSE. And if situations arise where we need a product to be tested and the client is willing to give us some of that product, we will send it to the HSE for rapid testing. So it's a very important facility to have in, we all remember in the last year or two, the recent nitazine overdoses and the nitazine clusters and the potential for loss of life there. So it's very important to be able to have rapid testing available to support that situation. So we talk about overdoses. We've had 222 non-fatal overdoses on the facility. Thank God we've had no fatalities on the facility, no recent no fatalities in the local environment either. And the overdoses have been managed in a combination of ways. 131 of those overdoses were dealt with oxygen only. 91 were a combination of oxygen and naloxone. I think it's important, and I would never, and I want to really stress, I would never underscore, undervalue the importance of naloxone. But from a client's perspective, if the overdose can be treated by oxygen therapy, it's preferable. It's not always possible, but it's preferable, because naloxone, as we all know, will reverse the effects of the drug, and there is always a potential risk when the person leaves the facility that they will go around the corner and take the drug again, and we could be back in a worse situation. So we are lucky because we have the facility. It's equipped to make a real-time assessment and make a decision. Our medical team will make a decision as to what the most appropriate intervention is. And as I say, the facts speak for themselves there. Some of the statistics around the type of people and the people who've used our service, you'll see that primarily the bulk of people who've used the service are between the ages of 25 and 54 years of age. I think that reflects the trends in relation to drug use. We know that heroin is a drug that has been, I suppose, a drug of choice for people who are a little more mature. And again, I suppose when we look at drug trends in the community and we look specifically at the prevalence of crack cocaine and cocaine, we perhaps have to have that conversation around facilities that cater for want of a better word, people who use other drugs. And so effectively what I'm saying there is that conversation around a drug consumption room as opposed to an injection room is something that is probably, it's time we had that conversation. So unique clients by gender, I think you won't be surprised. You'll see that it's almost an 80%, 20% split, 80% men, 20% women. We don't believe that that's a reflection of drug use within society. So we are appealing and we're trying to encourage more women to use the service. It's a safer service. And women have reluctantly, and this is my own experience over many years, is women, for a variety of reasons, have been reluctant to access services. I don't propose to go into the details. I think many of you will know some of the reasons why it is that there are barriers for women accessing services. We are trying to encourage as much as possible women to use the service if it's a service they need. And I suppose another interesting statistic would be unique clients by living situation. Now, there's no obligation on any client to tell us their living situation. So you will see that significant group of people don't answer the question. But if you look at the bottom three, rough sleeping, sleeping with friends and family, which is a very unstable situation, and temporary and emergency accommodation, you'll see that there are huge numbers of people, and that would be be consistent with information from organisations like Simon Community and other homeless charities that would say that there is a significant issue, a crossover between the tragedy of homelessness and drug use and mental health. So that's borne out in the statistics and in the people that use our service. So the impact of the MSIF to date, Well, Dublin Fire Brigade have reported that they dispatched 11 ambulances to Merchants Quay. Now, that would be the Merchants Quay area. To date, in 2024, and to date for 2025, only 6 ambulances have been dispatched. We know that the number of ambulances, the drop off in the number of ambulances being dispatched to to Merchants Quay and to the environment is very significant, because it allows Dublin Fire Brigade and the ambulance service to attend to other areas in a more speedy manner. So it has an impact. The EMPS, the medically supervised injection facility, has an impact on other medical services as well. And a very interesting piece of research, St. James's Hospital conducted an internal piece of research at their emergency department. And they noted, so they did a comparison for 3 months up to the opening of the facility, and the first 3 months the facility opened. And they saw a 20% reduction in the number of overdose presentations at the emergency department. But I suppose what's more important from our perspective is 46% reduction in opioid overdoses presenting to the hospital in that period. And that, it's a small snapshot in time, but it's a very important trend that demonstrates that a supervised injection facility does reduce the number of people attending emergency departments. And I think we all know our health services are stretched, and if people who are in overdose situation can be supported in facilities like the medically supervised injection facility, it allows the health service and the emergency departments to deal with other emergencies that present in emergency departments quicker. So we see a significant, I think there's a very important relevance to that piece of research, because it directly proves the importance of facilities like this for people who are drug dependent, who inject drugs, and for the most part do not want to attend emergency departments because of the experience they've had. And we won't discuss that this morning, but I think we all know that. So that's more or less a whistle stop of the medically supervised injection facility to date. A couple of key points to make. We are almost a year into an 18-month pilot. Very important now. The next 6 months is very important in terms of demonstrating to the government, essentially, but presenting the facts that this facility is saving lives. It is a very important facility for people who are very, very marginalised and very vulnerable. It's respectful, it's dignified, it's something that we would embrace, and we would hope that the pilot will be I suppose, become a mainstay in an element of drug treatment services that's vitally needed. So, Bear, that's as much as I suppose I've talked for long enough. I'm happy to take any questions if there are any. And thanks very much.
Thanks so much, Eddie. That it was absolutely fascinating, and it's so heartwarming to see the clear evidence of it working. One question that did come in, and I was busy looking in the background. You mentioned about the interim report that was done on the pilot. I couldn't find it online. Is it available?
So the interim report would be issued to the Department of Health and the HSE. So I'm not sure whether they've publicised it or whether they will. It's not for Merchants Quay to do. We are actually the subject of the report rather than the instigators of it. But I have seen it. It's very, very positive. It recommends some, improvements to the service, but they're all very positive and they're all very client focused recommendations.
Yeah, because I was thinking that, I was like, if it was published on your website or on the HSE's, I would have been able to find it with a quick search. So yeah.
So I can check that one out. I'm not. I know it's not. It's certainly not a document that is. It's for publication. It's a public document. So I'm sure at some point it will emerge.
Yeah. So just to remind people, you can use the Q&A function if you have any specific questions for Eddie. So you can put them into the Q&A box, and I'll bring them up. But just a couple of things. I was busy taking notes while you were chatting. What happens at the end of the 18 months? Like, will you get a couple of months notice of we're either rolling this on, or?
That's very interesting, because the license is very specific and the planning is also very specific, and there are two separate processes. So at the moment we are in a planning application process with the Dublin City Council to retain planning for the MSIF. and that decision will be made very close to the end of the pilot. So there are two potential risks. One is that the government would decide, or the HSE or Department of Health, but I would say the government essentially would decide not to continue with this service and it would close. Or the second would be that planning would be refused. And I'm not sure whether the facility will close. We don't know. Potentially it would. So we have two significant risks, but we're providing all of the necessary information to demonstrate the importance of this service. And I think that's all we can do. It's very much, I know we're talking, sometimes when we talk about data and we talk about evidence, we forget we're talking about people. And we are talking about people, but essentially for this process, we have to present the data to demonstrate how important and effective this service is.
Yeah, and it's a point that I make a lot in the work that we do in the Simon Communities of Ireland office, around policy and advocacy and lobbying and research, is we know the morally right things to do, but we do have to bring that evidence, and then the department will bring it into the Department of Public Expenditure and Reform, and there's all of those processes. So no, like it's been fascinating. Sorry, there's loads of questions jumping up now. So one of them there, so has the reaction from the local community improved since the service opened? I know objections delayed the opening of the service initially, and has the community seen the positive impact in terms of reductions in street injecting, etc.?
So the answer is yes. Certainly our relationship with the local community and businesses, the school, the various other stakeholders has improved dramatically. And there is a sense of let's wait and see. Let's see what the report demonstrates. A facility like a medically supervised injection facility will always be Marmite. So you will have people who see the necessity and the importance of the service, and you have people who don't. And it's not about changing people's minds. It's about listening to, I suppose, their concerns and addressing the concerns and minimizing the impact. So one of our key objectives is to develop a strong outreach team that is out there, both engaging with clients. And I mean, I'm always reluctant to throw the responsibility back on clients because they have so much to contend with. Homelessness, mental health issues, the drug dependency, and all those issues. But we do try to work with our clients around how they can help us to reduce the impact on the service. It's a gentle approach we take. It's not a stick. It's not even a carrot and stick. It's a carrot, and hopefully then. And I've seen situations where I've been out in the street myself. I've come across people who have been taking drugs on the street, and I've had a conversation. And I said, look, in a nice way, because I don't believe that there are very few people who take drugs on the street because they like taking drugs on the street. They take drugs on the street because they have nowhere else to take drugs. Yeah. So I don't want to make that simplify that, but that's the reality. But we are working closely with the local community and the various stakeholders to try and all coexist in a nice, professional and respectful manner.
Yeah, and so there was another question that was similar around that. So I've clicked that you've answered that as well, and I think it really did strike me that the proposal, over 10 years, was 2015, and that the legislation came in 2017. And then when you look at the data in your presentation, it's so upsetting to think about how many lives might have been saved in those years.
Yeah, it's so true. It's one of those unknowns, because we can't say with certainty how many would have been fatal and many, but we do know that the facility absolutely saves lives. There's no question about that. There is no question about
that. Someone is asking, and I know the answer to this, I know it's not a 24-hour service, but someone else has asked what the opening times are.
Sure. So we open 7 days a week. We open from 9:30 in the morning to 1 o'clock. And then we open from 2 to 7, Monday to Friday. And then on Saturday and Sunday, we open from 12 to 7. And I'm sure, again, part of the evaluation will be, does that meet the needs of our clients? Does the facility need to be open longer? Does it need to be open as long? And there are certainly, we collect, our information is so detailed. We know the busiest hour of the day. and we have all of that information. So I think we've got it right in terms of the opening hours, but again, that will be a decision for the funders, for the Department of Health and the HSE. And I have to say, like, the support from the Department of Health and the HSE has been nothing but positive throughout this process. And any issues we've had, they've supported us, they have the expertise. So it really is a good example of a really good collaboration between, both the department, the HSE as the providers, and ourselves. So yeah, and I'm sure you would experience the same with yourself in Usher's Island and other areas. Yeah.
Yeah, and it's really important, I suppose, to make that point, that where there are good examples of that collaborative piece, that, particularly if they are pilots, that they aren't kind of, ended, and you kind of go back to, oh well, let's try a new pilot. It's that thing of, if things are working, and actually on that, the St. James's Hospital saying about the 46% reduction in opioid overdoses coming into the emergency department. Again, we know what the morally right thing to do is, but if we're talking to the government, and particularly the Department of Public Expenditure and Reform, the economic return on investment is huge, and that's the other, the reason of the importance of the data. Someone else has asked here, so when clients present to the service, besides showing the drugs, what else are they required to provide? What info would you collect?
So we would obviously, at this stage, many of our clients we know. So, and a lot of our clients would have used other elements of our services, maybe our homeless service, our open access service, our needle exchange. So we would have gathered some information. But we know that people who are on the margins, particularly people who are living on the street or in very unstable accommodation, that information is not always accurate. And it's not always verifiable. So we would ask a person's name, and they might give us their real name, and they might give us a different name. We'd ask them where they, are they from Dublin City, or where part of the city? Are they in a stable accommodation or unstable? All of those kind of questions. And they can tell us the truth, or they can tell us a lie. It doesn't really matter. Like, at the end of the day, the objective in this service here is to save lives, and it is to work with people who are, I'm going to use the word ostracized in many ways, but they are ostracized from society. So to throw a level of, to require a level of information before accessing the service would defeat the purpose.
Yeah.
So, but I think what we have gained is a knowledge of the client through their continued engagement with the process. So, and people will share information. It might be in the aftercare room when they're having a conversation, they might just drop something in about a family member, and you get nuggets of information as you go along and build up a picture of the profile of the person. So it's that first contact piece is just like one important question would be, in the event of you becoming unresponsive, are you happy that we will intervene and use, or not so much are you happy, this is what we will do, you are aware of that. So that's an important piece of information, because we need the client to understand that at the end of the day, we will intervene and provide whatever care is necessary to support that person if they're in an unresponsive state.
So so someone doesn't have to come in with an ID to say this is my name, date of birth. And I was delighted that you very kindly arranged the visit for myself and the CEO of Dublin and Dundalk, Simon Catherine Kenny, went and got to visit the injection facility and see firsthand. And one of the things that struck me was kind of, the artwork and the coziness. And you could really tell that, that piece, as you said, about the aftercare room and having the chats, over the cup of tea, you could tell that if someone wants to build that relationship, or start to open up to staff, that's the atmosphere that you're creating, as well as the safe space.
Yeah, and Bear, it's interesting. Like, the overwhelming feedback from the clients is just one of absolute gratitude, because it's such a nice place. Okay, so they feel so valued because somebody would go to the lengths, and again, I have to pay absolute respect to the Department of Health and the HSE for this, because we worked together to provide this facility that would show some dignity and respect to people who are not used to being shown that dignity and respect. So and we also then renovated our ground floor, put in new showers and new toilet facilities, and made it more homely and welcoming. And that's a project that will always be ongoing. And we discussed before the webinar the importance of appropriate environments for people who are on the margins. It's not okay to say, we'll put a lick of paint on an old derelict building and use it as a facility. That's no longer acceptable. We need to provide, dignity of care as well as care.
Well, and if we want people to feel self-worth and self-esteem, that comes in the environment as well. Someone has asked, do you see a need for similar facilities in other cities like Cork? And if so, what steps need to take place now before the pilot ends?
Yeah, so I know from engagement with colleagues in Cork over the last number of years that there is a desire within a number of the service providers in Cork to provide a similar facility in Cork, and they see it's not a desire, they see the absolute need for a similar facility in Cork. And I think what we've learned over the years is because these types of facilities are quite controversial, and so there's a lot of planning, even long before a decision is made to open the facility. Organizations that have the capacity or the ability or the desire to operate a facility should be looking at the facilities now. I think what we've learned is, for example, I visited the facility in Portugal when I was on holidays last year, and it's a really good facility, but it is very specific in terms of it's a drug consumption room. And we believe that in integrated services where you provide a facility for people to inject or take drugs is one element of the service, where you have primary health care, where you have mental health team, where you have needle exchange, where you have access to food and showers or access to referrals onto other services. So it should be an integrated service. So I would encourage, and I mean, I'm not the policymaker here, so I don't know what will the eventual outcome will be. I would imagine, if I was a gambling man, which I'm not, I would imagine Cork is probably the next location that somewhere like this might be considered. And I think it would be important that it is co-located in a building, in a facility that is already supporting people, and it's just an extension. And we've always said, like, the missing piece in Riverbank, people come in to the needle exchange and got a clean needle and went out and around the corner and injected drugs. So the missing piece of the jigsaw, and that's very clinical, was the facility that provided that safe, dignified, health-led service. So I would advocate for that kind of a model. But it's not straightforward. It won't happen overnight. So you need to be thinking, and I think, a collaboration among service providers in Cork as to how they would like to see this develop could be a good starting point.
And the biggest block to MSIF in emergency Quay now was the objections from businesses and community, really, wasn't it? So
yeah, so it was. I think what any future facility, what should support the development is that the evidence that we gathered in this 18-month pilot is evidence that could be, associated with any other facility, and in many ways, like Riverbank, if you think about it, we are literally not even a kilometre from Temple Bar. We're directly across from the forecourts, the seat of justice in Ireland. We have a school directly behind us. We have a very big church beside us. O'Connell Bridge, big tourist area, people going up to the Guinness storehouse along the quays. So when we were able to locate it in that vicinity, it certainly shouldn't be more difficult to find another location in the likes of Cork that doesn't have that same sense of objections. And I understood, by the way, I never felt that the objections were vindictive. A lot of the objections were made out of a genuine fear of the unknown. Now we do know what the facility provides. We do know what the effects are. So that should make it easier, in my view, for other areas to look at how they could develop. And there won't be one in every county in Ireland or in every city in Ireland. If we've two in Ireland, it's probably as many as we will have. That'd be my view. It's a personal opinion. And I think, as I said at the outset, the supervised injection facility is only one element of very important treatment services for people who are in addiction.
And you mentioned a couple of times about the drug consumption room.
Yeah.
For someone, and I'm sure everyone on the webinar are much more up to date with all of this, but what would be the difference then? What would be the key difference between a drug consumption room and the injection facility?
Okay, so at the moment, you can only inject drugs, so you're quite limited in the drugs you can inject. Now, we know you can inject crack cocaine, but at the moment, the preferred method of taking crack cocaine is through a crack pipe. And
Okay.
people who are not really, I suppose, are not familiar with how people take drugs, still see people on the streets taking crack cocaine, and they still associate, well, why are people taking crack cocaine when there's a medically supervised injection facility? It's obviously not working. The reason they're doing it is because they can't smoke crack cocaine in our facility, so you can only inject drugs. So if we look at the drug trends and we look across at other jurisdictions that might have opened facilities a few years ago or 10 years ago, whatever, most of them have morphed into consumption rooms. So now they have the ability, so you can smoke crack cocaine, you can smoke cannabis, you can take tablets, whatever it is your drug of choices, and you can also inject. Our facility is designed and developed as an injection facility. So it or any other facility would require additional work. So, for example, you'd have to have suitable ventilation, and you would have to do some structural work, which we didn't do because it's not part of our license. But going forward, if we are serious about providing a facility for people to consume drugs, it's likely that we're going to have that conversation and say, well, the drug trends have changed. They're not quite what they were 10 years ago. You know, there's a stronger likelihood that people taking drugs will smoke crack or snort cocaine, whatever it is. So we need to be conscious of that. So that's, I suppose, the important conversation. And I'm sure it's being had as we speak.
But that would require a change in legislation as well as the license. Yeah,
it would.
Okay.
I think what again, I can't preempt the decision makers. What I think is likely to happen, you know, all going well, is that the license to operate the supervised injection facility will extend or will be continued on, and then a separate process will be looking at future needs and how a legislation is required to adopt for future needs. I would be hopeful that it won't be one or the other, and we'll see where that goes.
Yeah, and I suppose just thinking about that question about Cork as well, is that, you know, it would obviously make sense, as you said, to be looking at what the drug trends in Cork are, you know, so
Absolutely.
It wouldn't necessarily be a replication of what we have here. Yeah. No, it's so interesting, and it's just been incredible to see the numbers, Eddie, like 12,899 visits,
Yeah.
you know, over 1,300 clients, no fatalities. I was really interested as well, and I know it said this to you before we came online, to see that there is a number of people who are age 65 and older. Yeah, because that's something that we focused on during Simon Week, in Galway, Simon in particular, and we're going to be doing some more work on that in 2026 on people particularly over 65. So it's really interesting. So for policy geeks like myself, I love seeing the data and the evidence.
Yeah, and I think it's so important, Bear, because sometimes we have misconceptions, and we have stereotype of people who use particular services, and we often forget about people who are, and we talked about this earlier, who are disabled, for example, and people who are might have mental health issues, and we forget about older people. So when we gather as much specific information as possible, it really strengthens that argument to demonstrate that it's a whole of society problem. There's no one particular cohort of people that are okay. Some are more affected than others, but it doesn't choose. Yeah, exactly.
Yeah. And actually, before I let you go, the piece about women and the fact that it's kind of the 80-20, is that something that you talk to the women accessing the services to kind of say, well, what would, if there was like a women's afternoon? I know that might sound silly, but like, if there were specific time slots.
Yeah, it's actually not silly. It's it's something that's actively under consideration. We have a facility in Denzil Lane called Jane's Place, which is a women's only facility. And we got a lot of feedback, and we gather a lot of information through our interaction with the women who use that service. And the idea of a women-only time is certainly something considering. One of the barriers for women accessing the service is drug-related intimidation. It's owing money. It's violence. It's domestic violence. It's childcare. It's the fear of exposing yourself that you're a drug user in case that it has an impact on your child. So it's very, very complex, and we are kind of trying to pick our way through it. And again, as I said in the presentation, one of the key drivers is listening to the people who use the service and trying to find ways of facilitating their requests. But yeah, definitely that number is concerning. And we'd like to find ways of encouraging more women to use the service.
Yeah, and I think that, I'm glad you said it there as well, like to start your presentation so early about, and including the piece about peer input and listening to people with living experience. That's the exact point, isn't it? It's, we can all think we know what's best or whatever, but we need to be talking to people.
Well, one really interesting, one of our clients who has a really strong advocate, she's a lady, and she was explaining to a group who visited the facility what it was like to inject on the street. And it was and she said it in very stark terms. So she said, you've one eye on the street and you've one eye on the site you're injecting in. And she said, try to twist your eyes and look at two things at the one time. So she said it's both extremely dangerous, extremely undignified, fearful to try and inject on the streets and to try and find a location where you're not visible to others. And like that idea that you would be able to look at two things at the one time is just, it just brought it home to me, how important it was when the person goes into that booth, they can completely concentrate without fear, without retribution. They can concentrate on what they're doing. And I think we're very proud of that fact.
Yeah, and feel safe. They feel safe in that time.
Absolutely.
So yeah. Unless there are any other questions coming in, just to remind people that we've recorded this webinar, so it won't go up this week on our YouTube, but we will have it up in the next couple of weeks and we'll share it around. Eddie, just to say huge thank you to you and all of the team in Merchants Quay for the work that you all do, not just in MSIF. I think it's really so important, and it's so heartening to see the really positive statistics. As you said, it has saved lives over the last year, which is a testament to the amount of planning and everything that went into it.
And just to say thank you, we work very closely with Simon Community, a great organisation, and the best of luck to you and all of your colleagues and your affiliates for the work you do. And particularly, we're very conscious that Usher's Island is only down the road from us, and the incredible work that's been done there as well. So well done.
And actually, so I know this is our last Simon Talks of 2025, but I was thinking that the other day. I was like, I must get on to Catherine and see maybe if we did a Simon's Talks on Usher's Island and their experiences during next year. But someone has just jumped on and said they'd love more info on the oxygen therapy.
Yeah. So if a person becomes unresponsive, their oxygen levels drop. But if you went into an emergency department and you were feeling unwell, you'd see where they put a little thing on your finger to check your oxygen levels. So the first thing one of our nursing team will do is check the oxygen levels, and they will administer oxygen to the client and to see, does the oxygen level start to come up? And if they do, then they don't require naloxone. So it's about monitoring a situation. It can only be done by a medical professional or somebody who's it has to be a medical professional. Our nursing team do that. But what it does is, and I would never like to, as I say, confuse the conversation about the importance of naloxone. But from a client's perspective, they prefer oxygen to naloxone because naloxone reverses the effects of the drugs, which is very important when a person is in overdose, by the way. But in a facility like ours, we have that expertise to check oxygen levels and make an informed clinical decision as to the responsive nature of the client. And as you see from the statistics, in many of the cases, oxygen was enough to bring the person back and didn't require naloxone. But for the to impress the importance of naloxone and the development of the naloxone strategy, I would never want to confuse the issue. Naloxone in the community is so important, and so important that as many people as possible are trained in both understanding and administering naloxone in overdose situations. Our facility is very specific, and it has the expertise to make that informed decision as appropriate.
Yeah. Great. Well, listen, what a way to start the week.
Thanks very much.
Yeah, thanks so much. Have a lovely Monday, and we'll see you soon. And thanks so much to everyone for joining us. And a special shout out and thanks to Kleena for all the back and forth as well, Kleena, in your office, Eddie. Thanks so much, everyone.
Great. Thanks very much. Bye-bye.
Bye. Bye.